All right, y'all, let's talk about bipolar 2 disorder and why I think it's one of the hardest conditions to actually catch. And that's because it doesn't look like what you think bipolar disorder should look like. If you watch the whole video, I go on to say that bipolar 2 disorder can look like waves of depression, feelings of anxiety, and racing thoughts. And in my experience, I've seen bipolar 2 to manifest in patients primarily as frequent and multiple depressive episodes, a lot of anxiety, and brief moments of hypomania. So mania is a distinguishing feature of bipolar disorder. So without mania, you don't have bipolar disorder. So we know in bipolar 1, the main thing that you have to have is a manic episode. This is not a hypomanic one, but a full-blown manic episode where you have an elevated mood, you go days with little to no sleep, you don't feel like you need sleep, you feel invincible, you might be grandiose, there might be some psychosis involved. And when you have bipolar 1 disorder, or when you have a manic episode, and you go to the psych hospital, even if it hasn't been a full week, it's automatically classified as bipolar 1 disorder. So with bipolar 2, it's a little bit different. It's slightly different because you have the hypomanic episodes, yes, but you also have to have the depressive episodes. All right, I'm going to try and say this without making it too confusing because it took me forever to learn this in school. But with bipolar 1, you can be diagnosed with that just by having a manic episode and finding yourself in a psychiatric hospital. You don't technically have to have a depressive episode, even though a lot of people with bipolar 1 disorder do have depressive episodes. With bipolar 2 disorder, you have to have a depressive episode, like a full-blown depressive episode. For the better part of 2 weeks, you lost energy, it's hard to do things, no motivation, you feel like all your best moments are in the past, everything becomes such a nuisance, you're irritable because you're depressed, you can't get anything done, maybe thoughts of not wanting to be here. So a depressive episode, and on top of that, you have to have hypomania as well. That's the difference between bipolar 2 and bipolar 1. You have to have depressive episodes, and also the mania wouldn't be a full-blown manic episode. It would be hypomania. So think of hypomania as a baby mania. So this is the mania that it doesn't quite land you in the psychiatric hospital, but you are sometimes talking a bit faster than you normally talk. You're not getting as much sleep as you normally need, and you don't feel like you're missing anything. You probably are not making the best decisions. You are overspending, leading a lot more with emotion, hypersexuality, all these things. But it's not aggravated to the level to where it's a manic episode. And that's why it's hard to catch. Because I feel like with bipolar 2 disorder, at least in my experience, the majority of patients I've seen, they spend more of their time in the depressive side of things. So you're depressive, or you're depressed, you're anxious, you're feeling on edge, you have these racing thoughts. And every now and then we have these moments of euphoria, but sometimes it feels like it's few and far in between. You're just more so depressed. And when you go to the doctor's office and you appear to be depressed, what they're going to do is they're going to give you an antidepressant because all they see is a depression. And this is why you have to get extra information, whether you talk to the patient's family members or maybe you get a thorough history. Like these, sometimes people DM me and say that they talk to their doctor, the psychiatrist, for like 25 minutes and then they got a diagnosis. I don't know on what planet you would do that, because you got to get some more information. Because if you have bipolar, any form of bipolar disorder, but we're talking about bipolar 2 here. If you have bipolar 2 and you appear to be depressed and you go to the doctor and they give you an antidepressant, there's a chance that it can push you into mania or hypomania. So now, we've solved one problem, but now we're on the other side of things. And you have no mood stabilizer to level you out and keep your mood even. So when you have bipolar disorder, bipolar 2 included in that, you can be on an antidepressant, but normally you wouldn't want to be on an antidepressant without a mood stabilizer. You're talking about your lithiums, your Depakotes, or an antipsychotic, Zyprexa, Risperdal, Seroquel, so on and so forth, Latuda. But you normally would need a mood stabilizer with your antidepressant. or else mania is what's going to happen. So bipolar 2 disorder is one of the harder conditions to catch. And like I said, I think I'm pretty good at what I do. I'm trying to be humble, but bipolar 2 is really difficult to catch. It's really hard to catch. It's hard. It's hard. So you have to really take your time with the patient. You got to get a good history. And any patient who is going to the doctor for depression should automatically be screened for bipolar disorder, in my opinion. And without doing that, you're going to miss diagnoses like bipolar 2, because like I said, it looks a lot like depression, anxiety, restlessness, and racing thoughts. So hopefully this video has been helpful. I think I've done my best to explain it without it being too confusing.